Welcome to For the Health of It, our series where we bring together some of the world's top scientists, analysts, and health experts to discuss the biggest challenges in healthcare today. I'm your host, Bill Evans. With us today is Bonnie Schneider, director and co-founder of the IgAN Foundation. Welcome, Bonnie, and we're thrilled to have you.
Thank you for having me. I'm excited to be here and share my story.
Let's start with that. I've had the privilege to talk to a number of founders of nonprofit foundations, and you and your husband founded IgAN in 2004. Can you tell us your origin story and how the foundation came to be?
Yes, I'd love to. First of all, it's the IgA Nephropathy Foundation of America, but we call it IgAN for short because so many people have a hard time saying the word nephropathy. So back in 2004, our son Eddie was at age 13. We sent him back to school after having an upper respiratory infection, which is pretty classic to the onset of the disease. When he came home, he said his urine looked like Coca-Cola. So as a mother, of course, first thing I want to do, send him to the bathroom. It was not only Coca-Cola colored, but it was thick, really thick and murky. We immediately took him to our pediatrician, who's also a friend of ours. And within a couple hours, he was in the hospital. Steve, our pediatrician, really didn't want him to go to the hospital. He thought that, if it was IgA nephropathy, it really can't be treated, that he was best to go home. And to me, I was not taking a boy home that was bleeding like that. I wanted somebody else to take care of him, get him out of my hands and into a safe place. Fast track later, a week later, it was a confirmed diagnosis that he had IgA nephropathy. We went through two really, really rough years where he missed 45 days of school the first year and half of that the second year. Had a very, very difficult time. He was on steroids, which was really the only treatment for it other than ACE and ARBs. His face blew up. I think he gained close to 50 pounds. And at a 13-year-old age, kids make fun of him. They tease him, the kidney boy. He went through a lot. It was a really tough journey. And I think during that, I really needed to reach out and find other parents that could assist me, help me get through it and get through this new disease that I had no idea what was happening. I couldn't find anybody. It was terrible. I was like, where is everybody? This disease is so rare. There's nobody in my community. I even put it in the newspaper, searching for just anybody. So I ended up working alongside with the National Kidney Foundation for a couple of years and raising money and earmarking that money for IgA nephropathy specifically. Then after a couple of years, I realized, what are the people that have this disease? Where are they going? Where's their safe place? That's when I talked to my husband and we decided that I would quit my job in Manhattan and take this on as a mission. And 18 years later, we have over 16,000 patients in our Facebook group alone. And we have an incredible leadership team that really guides us through and assists patients. So it's been a really, really, I feel like it's a blessing that God chose me for this, to take this on, because every day I feel really great about what I do.
That's a very incredible story. I am curious, part of your mission is to be a patient-centered organization in your quest to find a cure. Can you talk a little bit about what that specifically means?
Yes, I would love to. What sets our organization apart from other organizations, everybody within the foundation is either a patient or a caregiver. So we're kind of by patients for patients. And I really think that's why we have been able to do so many patient programs and bring our patients so much education to help them navigate their journey, because we all know it. We all have skin in the game. And at the end of the day, when most people, you work for a nonprofit, you go home and you're like, oh, thank God I'm home. We're worrying more. How are we going to do this? How are we going to find a cure? How are we going to get better drugs on the market? And it really makes us move the needle so much faster.
So it sounds like in your story, your son presented with some very dramatic symptoms, but I know this can oftentimes be a difficult to diagnose disease. Can you talk a little bit about that and why it is, and maybe some things that your foundation is doing to help bring diagnosis to bear faster?
Yeah, so that's a really, really important part of what we're discovering, what's been a problem for 18 years. When it really comes down to it, one of the biggest problems is children don't get a urinalysis at an annual meeting at their pediatrician. If Eddie had had that urinalysis, we would have known way before the onset that there was something, he was spilling protein in his urine. So that is a big gap. And I'm actually working with KDIGO to establish better guidelines so we can get those urinalysis early on. I'm actually in 2 committees working on doing that. We would have so much preparation. Not only we would alter the way we're eating sodium, you don't realize what you have until it's gone. So if we were able to have that early diagnosis, it wouldn't save everybody, but it would save at least 60% of our patients.
On top of that, I think one of the things I know you care deeply about is helping to connect patients with resources to help make more informed decisions, whether it's just like you mentioned, pushing for an early diagnostic test, things like that. What hurdles are patients finding? Is it it's not a well-known disease? Are resources, information, tools just not readily available? Is there a dearth of support systems for these patients? Like what's the biggest gap currently that your group is facing?
One of the biggest gaps is lack of communication between the nephrologist and the patient. It is really a lot of our patients, their nephrologists don't even know that we exist, and they really don't understand IgA nephropathy. So thanks to Komodo, I bring this up now, we're so grateful with our partnership with them that they have been able to help us get into contact with nephrologists all across the country. And we're able to share our 32-page patient guide with them, let them know that that we're here, and in between their visits, we'll help their patients navigate their disease process. So that has been our biggest gap, and we're working on that slowly. During IgA Nephropathy Awareness Day, which we have on May 14th, we held our first one ever this May. We sent out 4,500 coffee mugs saying, "Save the beans," and let them know, if you have a patient that has IgA nephropathy, please let them know that we're here. Here are some one sheets that they can download and give it to their patients upon diagnosis. And then we also address the doctors who have not had an IgA nephropathy patient. We gave them a different letter explaining what the disease is more in depth, and let them know that we're here and we're a trusted resource to help their patients.
So do you believe the information gap is really an awareness problem, or is there also a misunderstanding among treating clinicians that is preventing early diagnosis from happening more frequently?
I think the newer nephrologists that are coming out understand it. For 18 years, at least 15 years of those, it was a very quiet space. I was working against everything to try to get our name out there and about the disease. I went to Capitol Hill. I went to the National Institute of Health, brought my board of directors. Like, we really fought to get their name out there. And now there's 14 ongoing clinical trials for IgAN, 1 approved therapy, and 1's ready to be approved November 17th. So a lot of those nephrologists years ago, they really weren't in an exciting place. So I think nature has a way of just kind of being like, oh, well, that's kind of like too much information to share. It's 7 minutes in the office, and it's not all of them. There's a lot of wonderful nephrologists, please don't get me wrong. But I really feel that excitement is only found in the newer nephrologists coming in, or even have been there for about 10 years, because it is a very exciting time in our space right now.
So you mentioned before the desire to bring more effective drugs to market. We know, especially in rare disease, finding those patients for clinical trials can be a challenge. Talk a little bit about like where you see the biggest gaps in getting more, patients into trials. Is it an awareness issue? Are there just not enough trials going on? Like what are the things people watching should know to understand the dynamics of the situation a little more completely?
So we have 14 ongoing clinical trials. I work hand in hand with all of our industry partners because it's really important. Some of these drugs are going to work for some of our patients, and then other ones will work for the other patients. It's really a necessity to get all of these drugs to market. They're proven to slow the progression and almost halt the progression for IgA nephropathy. I mean, it's really, really a blessing that this is happening in our space right now. So it's imperative that if the nephrologists are not telling the patients about the clinical trials, which happens to be a lot going on in our Facebook support group, oh, how come my doctor never told me about that? How did you get this information? We'll pull them over to our website where we have every clinical trial listed. And at the same time we're doing that, when we did that outreach during the IgA Nephropathy Awareness Day, we also let them know that we were here in order for them to send patients, so that we can, if they're not telling them, we will then tell them. So we're kind of covering every gap that we have. It's a big feat to take on, but we're looking at the end picture. What do we want? We want a cure. So we're just doing everything that we feasibly can to make that happen.
You mentioned the partnership before with Komodo, and another partner included in that is Chinook Therapeutics. As you use the data and the resources as part of that partnership to identify these clinicians to do outreach and provide more information, was there anything surprising that you found, maybe that you didn't expect to see, either pockets of clinicians maybe that you didn't expect were treating this kind of patient? Like, was there an aha moment that really led you to an insight that changed the way that you were, approaching this problem?
Yeah, again, thanks to Chinook for even opening up this relationship with Komodo and us. We're so grateful. Everything I'm about to say would never have happened without your support. What we found, what our biggest aha moment through this reach out was discovering, we knew that the Asian population was 33% of IgA nephropathy patients. That's a lot of patients, Asian and South Asian, that have IgA nephropathy compared to the rest of the world. So what we found out was some of these doctors in isolated areas have as many as 150 patients that have IgA nephropathy. So we're now in the process of translating our patient guide, which is 32 pages, into their native languages. Even in in India, we're working along with the Center of Excellence down there, helping support them. And they really have a lot of unmet needs. So we feel really good about stepping out and be able to make that difference and educate them, especially being 33%. Through this, we're also trying to figure out why is it Asian and South Asian? Why are they so affected with IgA nephropathy? So we're still discovering aha moments. I probably can share more with you as we go through this journey, because it really unleashed so much information to us, and we're just building, we're just gaining momentum from that open door, which we're so grateful for.
And so obviously finding a cure for such a complicated disease can be an uphill challenge. What's giving you the most optimism that you can reach your goal and bring a cure to market?
18 years ago, I took this on, and then 16 years, I said, I'm going to quit my job and I'm going to do this. And I think if you believe in something and you believe wholeheartedly and you don't take no, I've had doors shut on me. I've had people, I almost merged with another foundation just because I just didn't have the bandwidth to take on this huge animal. And I just never gave up. And I just, right at the ending point, signing, I had people come out, patients and caregivers that were like, can I help? I want to get involved. And that's where my leadership team came from. And it really, it's amazing what we're able to do. So we're going to get a cure. We're definitely going to get a cure. Dr. Barrett, one of our UK partners, and he's also on our scientific and medical advisory board, he believes we're going to get a cure. If he believes we're going to get a cure, we're going to get a cure.
Excellent. So as we wrap up here, what are some ways that folks can get involved to participate in helping to bring a cure to the patients that need it so desperately?
Well, we would love to have their involvement and come to our annual meeting. We call it Spark, because when you get enough people in a room that believe in a mission, what does it create? A spark. So we call it Spark. This year, it's going to be held in Washington, D.C. It's July 21st through the 23rd. We have nephrologists from all around the world come and discuss the disease process, answer questions. We have patient panels where patients can hear other patients' stories, meet and greet where patients can get to know other patients. Last year, we had our meeting in Nashville, and it was really amazing to see people meeting patients for the first time that understand what they're going through. And by the end of it, they're exchanging email addresses and hugging at the door and doing the Texas two-step at the Wild Horse Saloon together. Meanwhile, they never knew anybody else that had the disease. So that's very, very empowering. You leave really feeling changed. So we welcome anybody who would like to come or even speak. Reach out to me, Bonnie@IgAN.org. I would love to hear from anybody that's interested.
Sounds like an awesome event.
It is.
So thank you so much for spending some time with us today. You have an inspirational story and an inspirational mission, and we at Komodo obviously wish you the best of luck in advancing towards finding a cure for your patients who need it so desperately.
And thank you, Bill, and thank you to Komodo for opening up this door. That's really a treasure to us. We're very grateful, and to Chinook for the introduction.
So for those watching to learn more about Bonnie and the incredible work of the IgAN Foundation, you can follow them on Twitter, YouTube, and Instagram at IgAN Foundation. And to learn more about Komodo Health and how we're working to reduce the burden of disease, be sure to check out komodohealth.com. I'm your host, Bill Evans. See you next time.